Welcome to Biology Minds. Today we're going to talk about the appendicular skeleton. So just like we talked about the axial skeleton, the skeletal system is really broken up into two different parts. We have the axial skeleton, which we spoke about, which is really the core, and then the appendicular skeleton, which says it all within its name. It's the appendages, what is going to be connected to the axial skeleton. So just like we had 80 bones make up our axial skeleton, we have 126 bones that make up the rest that ends up coming to 206 bones. So it allows us to move and manipulate objects, our appendages, our arms, our legs, our hands, our feet. That allows us locomotion, being able to move, and also allows us to manipulate and move objects. Okay, includes the limbs and the supportive pectoral and pelvic girdles. We have, of course, we have the axial skeleton, which is our core. And then we have the pectoral girdle that comes off of our rib cage and is made up of our clavicles or our collarbones, and then our shoulder blades or our scapulae. And that is going to, off of our shoulder joint, we're going to have our humerus, and then we are going to have our radius on the thumb side, okay, and our ulna on the pinky side. So you have to think of it not right or left because it's a mirror image on the opposite side. It's really radius on the thumb side, and then we have our ulna on the pinky side. And then we were going to have our wrist bones, which we call our carpal bones. We have our palm bones, which we are going to call our metacarpals, and then our fingers are called our phalanges, and that is the same on both sides. In our typical fingers, we're going to have 3 segments of our phalanges, and then the thumb, we're only going to have 2 segments. Once we move down, we are going to have our pelvic girdle, which is going to be formed by our hip bones. And from the hip bones, or from the hip joint, you're going to have your femur. Okay, remember that the femur is a giant long bone, so we're going to have a lot of red bone marrow. This is a powerhouse of red blood cell production. The femurs are very strong bones. They're actually harder than concrete, so they're very strong. Typically, we don't hear about people breaking them unless they're in a major car accident or some kind of major accident. But typically, sports injuries, you're not going to hear about broken femurs. More or less, you're going to hear about issues with the knee. Okay, the knee joint is going to give way, where you're going to have MCL injuries, ACL injuries. You'll even hear about Achilles tendon injuries, which are going to be down here. But typically, you're not going to hear about a broken femur. And oftentimes, you don't hear about too many problems with the hip joint. It's a very stable joint. But from this knee joint, you have this kneecap, which is the patella. And it goes down to this primary lower leg bone, which is the tibia. And behind it, this is how I always remember which one is which, but behind it, kind of telling a little lie, telling a little fib, is the fibula, not the fibia, not the tibula, but the fibula is kind of lateral and behind or posterior to the tibia. And then you have your ankle bones, which are going to be called tarsals, just like in the wrist we call them carpals. Here they are tarsals, and then you're going to have your foot bones as your metatarsals, and then just like your toes and your fingers, they are still called phalanges. Your pectoral girdle or your shoulder girdle connects the arms to the body. You have 2 clavicles, 1 on each side, and 2 scapulae, 1 on each side as well. And the clavicles are also called collarbones. They're long, kind of S-shaped bones that originate at the manubrium, or that top part of the sternum, and they articulate with, or they form a joint with the scapula. You see, this is where the humerus links up with the scapula, and you have the scapula linking up with the clavicle right there. You have this manubrium, which is the part of the sternum, and there's this little kind of depression, which we call the jugular notch. You have your lateral, or your outside portion of your clavicle, and your medial, or your inside portion. You have the cunoid tubercle, costotuberosity. Okay, remember, anything that is going to be a process is there for attachment of muscles. Scapula, they are called shoulder blades. The scapula has a glenoid cavity. Okay, that's the cavity. That's your actual shoulder joint where the humerus is going to link up with it, and we call that the glenohumeral joint. The processes of the glenoid cavity are the coracoid process and the acromion. So here you have this coracoid process and this acromion, where this humerus is going to fit into there, and it makes this joint very movable. All right, highly movable joint, and that's how we're able to throw a baseball. All right, if you notice with your hip, okay, your hip is not as movable, okay, but it's also less stable. All right, when we talk about the hip, it's less movable, but much more stable. So just some things to think about. You have the body of your scapula, your subscapular fossa. This is like a depression area. Your lateral border, your medial border, inferior angle, superior angle. This is the superior border. Okay, and just some major things to remember, that you have this coracoid process and this acromion area. Those are two parts that are going to help that humerus lock into that shoulder joint, or that pectoral girdle. Glenoid cavity. All right, posterior features, you have the scapular spine, supraspinous spinous fossa, and infraspinous fossa. Upper limbs, you have your arms, your forearms, your wrists, your hands. Humerus is going to be the arm. Then some major portions are going to be the greater tubercle, lesser tubercle. You have the head of the humerus, the anatomical neck, and then you also have the surgical neck. Deltoid tuberosity, right, attaches the deltoid muscle. So as we move into talking about muscles, you're going to realize that a lot of these names are named that for a reason. It's because whoever came up with naming the muscles, then they also came up with naming the way that the muscles attach to the bone. You also have a radial groove for the radial nerve. The distal epiphysis is medial and lateral epicondyles. The condyle of the humerus is going to articulate with the ulna and the radius. You have the trochlea, you have the coronoid fossa, and the olecranon fossa helps to lock those bones together so that that elbow is more stable. Okay, your elbow is not highly movable. Doesn't really allow for many different directions like your shoulder does, but it is a little bit more stable. And then you have the capitulum. It's with a radial fossa, which is going to articulate with the radius, one of the forearm bones. So here you see the head. This head is going to lock into that pectoral girdle, and down here you have your elbow region, where the trochlea is going to lock into the ulna and the radius. You have the radius and the ulna having their own portions that help to lock into the trochlea. You see that the ulna has the olecranon, which is going to fit right into that olecranon fossa of the humerus. So this olecranon fossa of the humerus is right here, and this olecranon is actually like a hook that kind of fits right into that portion. So when you think about the names, they name these things for a reason. Remember, ulna is going to be medial. Okay, I like to think of it as the pinky side because you can kind of twist your hand around. So one time it's medial, another time it's lateral. But when you think about it, it's always going to be on your pinky side, and your radius is always going to be on your thumb side. The ulna has that olecranon that's going to lock into that olecranon process, or fossa, I should say. And the forearm flex, the coronoid process enters the coronoid fossa. You have the radial notch for that radial nerve, and then the ulnar head has the styloid process to it, attached for the articular disc between the forearm and the wrist. Here we see our ulna and our radius. The ulna has that olecranon, which is going to fit into the olecranon fossa. And then down here you have your styloid process of the ulna and your styloid process of the radius, which is going to help create that wrist joint. All right, so here you're going to see the carpals. You have 8 carpal bones on each wrist. The scaphoid, the lunate, the trichitrum, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. All right, these are our carpals. And then we number our metacarpals. The thumb is number 1, index finger 2, middle finger 3, ring finger 4, and then pinky is 5. And then we have our phalanges. We have our coxal bones, or our hip bones. You have this top portion here, which we call the ilium. This front or anterior portion is going to be the pubis, and then this inferior and posterior portion is called the ischium. Within each portion in the ilium, you have your iliac crest right here, your iliac spine, and you're going to have your pubis right here, which is going to have your superior ramus, your inferior ramus, and you'll have the ischial ramus with your ischial tuberosity, and here you have your iliac spine, and here you have your greater sciatic notch where the sciatic nerve is going to travel through. Okay, you have your iliac fossa on the inside. We're going to see in the pubis you have your pubic tubercle. This is a better view how we normally see it. All right, you have your sacrum, and your coccyx is back here, and then you are going to have your ilium. You're going to have your pubis, and you're going to have your ischium. Right here we have a pubic symphysis, where we're going to see that in females it actually tears during childbirth. So that's one way to know if if we found a skeleton somewhere and we looked at this, we'd be able to tell, hey, did this woman ever bear children? Also, if we look at the different size and shape of the hip bones, you can tell if it's a male or a female. We have the acetabulum. This is where the head of the femur is going to connect or link in with this hip bone, and it creates a very sturdy joint. This is a posterior view of this. Here we see a superior view. All right, pelvic outlet, pelvic inlet. All right, they're going to be different between males and females. We see that males and females differ in many different ways. The angle of their femurs, the size of their hip bones, also in their skulls. So men typically have heavier skulls, and their foreheads are more sloping, where females it's more vertical. Sinuses are larger in males, teeth are larger in males, and then the jaw typically is larger and more robust, where females have more dainty or less robust mandibles. When we look at the pelvis, we see that females have an enlarged pelvic outlet and men have a more narrow one. They also have a shallower iliac fossa, and men have a deeper iliac fossa. All right, so this right here is going to be deeper in men, and in females it's going to be more dish-like or more shallow. As well as the pubic angle, it's going to be less than or under 90 degrees typically in males, and in females it's going to be greater than 100 degrees, definitely greater than 90 degrees. And bone weight, heavier in males, more prominent. In females, less prominent and lighter in weight. Function of the lower limb, motion, locomotion, bearing weight. Okay, we have our upper leg or our thigh, which is going to be our femur, and our lower leg, which is going to be our tibia or fibula, and our tarsals, metatarsals, and our phalanges or our toes, along with our kneecaps. So the femoral head is going to fit into the acetabulum, attaches at the fovea capitis, the greater trochanter and lesser trochanter, that's where tendon attachment occurs. Linea aspera is within the shaft of the femur, most prominent ridge of the shaft, and it attaches the hip muscle. So whenever we see these prominent processes, that's for typically muscle and tendon attachment. You have the distal epiphysis with our medial epicondyle and lateral epicondyle above the knee joint. These are going to be separated by intercondylar fossa and patellar surface, form part of the knee joint. So we have this head of our femur going into the acetabulum. You have your shaft, and then you have your lateral condyle, your medial condyle, and they're going to help form that knee joint. You have your patella, which is the kneecap. The base attaches to the quadriceps femoris, which is part of one of the quadriceps muscles, and the apex attaches to the patellar ligament. Here you have your kneecap. Tibia, also called the shin bone, that's the larger one out in front, the anterior one, and then you have the fibula, which is kind of posterior to the tibia. The proximal epiphysis, medial and lateral tibial condyles are going to be separated by the intercondylar eminence, and then articulate with the medial and lateral condyles of the femur. The tibial tuberosity attaches the patellar ligament. So we see that all of these ligaments and these tendons are going to come together at this knee joint. The shaft has an anterior margin, which is a sharp ridge of the shin bone, and then the distal epiphysis has the medial malleolus, which is the projection on your ankle. So if you feel your ankle, you can feel on the inside it's like something jutting out. That part of your ankle is called the medial malleolus. The fibula attaches the muscles of the feet and the toes, smaller than the tibia, and lateral to the tibia, also posterior to the tibia. And then that fibula is going to form your lateral malleolus. So just like you have a bump on the inside of your ankle, on the outside of the ankle, you also have a bump, but that bump is the lateral malleolus formed by the fibula. Okay, so the fibula is going to form our lateral malleolus, and the tibia is going to form our medial malleolus. And then we have our ankle bones, okay, which are going to be called tarsal bones. The main one that we talk about, or main two, the biggest one is called the talus, and then our heel bone is called our calcaneus. We also have a cuboid, which articulates with the calcaneus. And you have your navicular, another major ankle bone, medial cuneiform, intermediate cuneiform, and lateral cuneiform. And then you're going to have your metatarsal bones, which we number the same way. Your big toe or your hallux is going to be 1, and then so on and so forth. And then you have your phalanges